Hello everyone, it's Dr. Parissis again, and what I want to talk about today is, should you get a hair transplant? I want to answer this question concisely, and I think the best way to do this is to summarize the three main categories of patients that will benefit from a hair transplant. Let's go through patient A, patient B, and patient C. First of all, patient A. Patient A is the obvious patient who has lost pretty much all of his hair. This is a patient who's in at least the Norwood 5 or more category in the Norwood classification of male pattern baldness, and they really don't have much to work with in terms of preventing any further loss. So they're not really going to benefit from finasteride and minoxidil. Remember that finasteride maintains already existing hair and minoxidil strengthens already existing hair follicles. And so if there's no hair follicles to begin with, i.e. if they've completely died and they've completely miniaturized to the point where they no longer grow at all, well then you really can't bring hair follicles back from the dead. And so hair transplant surgery is really the only way to cover completely bald areas of scalp. So I want to give you an example of this patient here. He's 70 years old and he's pretty much lost all of his hair. He lived and grew up during a generation where hair transplant surgery wasn't as it is today, and he was a little bit hesitant to start on medications. But what we might do for him is we'd analyze his donor area, and you can see that he's got great donor area to work with. So with this patient, we'll do an FUT or strip procedure where we'll take as many androgen resistant grafts in that donor area as possible, and we'll recreate a hairline for him. We'll do the first portion of the scalp first, and he might need a second procedure if he does care or if he's bothered about the crown region being empty. So we'll fill in the crown region with a separate surgery. And we'll do both surgeries via FUT, and if he has further loss and he wants further density or lower the hairline anymore in the future, then we'll utilize FUE. Our second patient example is patient B. So he's from our second category of patients that I believe would benefit from hair transplant surgery. This patient is someone who's, let's say, they've lost a significant amount of hair. So they've lost enough hair where, you know, it's bothering them and it's noticeable. So they might be a Norwood 3 or Norwood 4 patient, but they haven't lost all their hair. They're on medications, they're on vitamins, supplementation to support hair growth, and they've managed to stop or slow down the progression of their hair loss with these. As with a lot of medications, unfortunately, they're not very good at bringing back the growth of the hair. As I said, they cannot bring back hair follicles from the dead. And so really the only way for patient B to restore his hairline back to where he might want it to be is through hair transplant surgery. For this patient, we'll be a little bit more conservative with how many grafts that we take from his donor area. He could lose more hair down the line because medications slow down hair loss, but they don't stop it for good. We probably aim to take around about 1,000 to 2,000 hair grafts and densely pack the frontal band region in order to restore his hairline. The overall kind of strategy for this patient is he's utilizing hair transplant surgery to regain what he's lost, and then he's going to kind of cruise on finasteride and minoxidil to maintain the hair that he has. Patient C is a patient who has lost some hair. Haven't lost a significant amount. They haven't lost all their hair. They've lost an amount whereby it's somewhat bothering them. So it might be a patient who's, let's say, 30 to 40 years old and he's around about a Norwood 2. So he really doesn't have a high sensitivity to DHT. Let's say it's bothering him to the degree that he wants to restore himself to a Norwood 1. What we'd recommend for this patient is to perform a very small case, a small FUT procedure, or perhaps an FUE. And I believe that FUE should only be used for small procedures. And we'll utilize either technique to restore that hairline. Maybe put in around about 1,000 grafts to do this. Dr. Bloxham does have a lot of these patients who have not lost a lot of hair, and some patients who might fit into this category are patients who were born with slightly higher hairlines than they would have liked, or that they might have a kind of asymmetry between the right or left side of their hairline that they'd like to fill in. And so these patients really don't require many grafts, and they come into our clinic for top-ups or fill-ins, if you like, in order to achieve this. The question I encourage you to ask yourself is, do you fit into one of these categories? Do you think that hair transplant surgery would benefit you? I do want to emphasize a few important points that I feel people are slightly misguided by at the moment with regards to hair transplant surgery. I want to reassure you that hair transplant surgery has gotten so much better than the days of the 80s and the 90s where patients were receiving hair plugs. These patients were getting very unnatural results and were receiving that kind of doll-like appearance to their hair where the hair follicles looked artificial. Recently, I've seen so many people's lives actually being completely changed by hair transplant surgery. It is revolutionary, really. It gives those people who have lost so much hair that there's no other option. It gives them the opportunity to regain ground. Just to summarize, these are the 3 patients that would most benefit from hair transplant surgery. I also want to stress that many people use hair transplant surgery as a tool alongside preventative therapy. But really, as time has gone on and as techniques have advanced, that there's very little to fear with hair transplant surgery. I do want to show this paper which does emphasize just how few complications there are from hair transplant surgery. Of course, as with any surgery, there's not zero risk of complications. The main ones, bleeding, infection, are always going to be there, but the rates are really, really low, and that is something to consider. And the last thing is just how good the results are. I do want you to have a look through fellermedical.com, go to the results page and just see how good results we are actually achieving. It really is amazing, and this comes from a place of sincerity for me. I have faith in hair transplant surgery, and I just want you to be reassured that you could have faith too. I really do know that hair loss feels like the floor beneath you has just completely disappeared. And it doesn't need to feel like that. If you know that you can always fall back on that tool of hair transplant surgery, then you're going to feel less stressed, and you're going to know that it's in your arsenal. It's there for you, and of course, there are lots of things to consider before doing so, but we are able to achieve amazing things. Thank you very much for listening. Just on a final note, I want to thank everyone for subscribing. I am pretty much overwhelmed with the response from you guys. I love the comments. I absolutely jump to replying to as many comments as I can. I just think that many people are asking very insightful questions that make me think sometimes. You guys give me so many ideas for future videos that I'm absolutely buzzing to get into. We've got so many upcoming projects with Dr. Bloxham. We've got the paper that we're about to publish. We've got some work that we're both going to collaborate on with verteporfin, a new compound that's showing a lot of promise in terms of regrowing hair in the safe donor area after hair transplant surgery. I am constantly keeping up to date with new research on finasteride, minoxidil, and other novel techniques of combating hair loss, because I just really am fascinated by it. I genuinely believe that hair loss is a tragedy amongst young men. I think no one prepares you for it. No one tells you in school that you're going to lose your hair, and it just happens, and you've got to deal with it by yourself. You can feel really, really helpless. And I just think that if I can create a channel that makes people feel slightly less helpless about hair loss, and give them promise and reassure them that there are amazing treatments and procedures that can be done that really can transform your life and make you just relieve you from the stress that is hair loss. It just constantly consumes people, and it constantly consumes me, to be honest. And so I just think that if we can come together, then that will just put more money, resources, time and effort to making hair loss a thing of the past, really. Definitely do look on fellermedical.com. Look at how good the hair transplant surgery results are. They really are excellent. So many patients have just clearly benefited off it. I think it's something that you should consider either now or in the future. Don't hesitate to reach out to myself if you've got questions regarding it at drparissis@gmail.com. And if you're interested in a consultation where we can discuss whether you would be a candidate for hair transplant surgery or any specific considerations that need to be made in your particular case, make an inquiry on fellermedical.com and mention myself, Dr. Parissis.